Hey, good morning, everybody. Welcome to the COVID-19 care conversation. We've made it to Wednesday, Ryan. We have a very special guest on today. Senator Brian Schatz is joining us to take your questions all about federal help. Thank you, everyone, for being here. Please put your questions in the comments. We're going to get to him in just a moment. Good morning. I'm Yenji Denise.
And I'm Ryan Calais Suji. We want to thank all of you for tuning in here to our conversation. We're entering week 3 here of this effort to really build a community online and connect you with some of the people, some of our leaders who are making these decisions, and allow you the opportunity to hear directly from them some of the things they're working on. As Yanji said, Senator Brian Schatz will be with us in just a few moments. We're excited to hear from him and the federal efforts that are being made. So if you have any questions for the senator, please feel free to type them into the comments. And we will also want to encourage you to share this, like this, as well as promote this on your platform so that we can reach a wider audience and continue to engage in this important conversation.
Yes, of course, what makes this show different than the regular news is that we get to have a back and forth. We get to take your questions and pose them directly to those in power. Yesterday, we had such a great response on our conversation with Scott Murakami, of course, the head of the unemployment office, who is inundated right now, and we're going to have him on again very soon. Before we get to Senator Schatz, we, of course, want to start with the count. And Ryan, can you lead us off with that?
That's right. As of Tuesday, 23 new cases, COVID-19 confirmed cases here in the state of Hawaii, for a total of 410 positive cases. No new deaths reported yesterday, so they're still at 5. And there were 16 new hospitalizations. That was one of the key numbers that officials want people to focus in on, is making sure that while our numbers may be at 400, being able to be manageable in those that are being hospitalized.
That's right. And just a public service announcement here. There is free testing at the Waianae Small Boat Harbor, 9 to 11 on Thursday. That, of course, is tomorrow. That'll be by Premier Medical Group Hawaii. The phone number to find out if you should head down there, before you get in line, we've put it in the show description. So you can call Premier Medical Group. We've put that in there for you. So make sure you give them a call before you head on down there. Again, that testing is free, 9 to 11 at the Waianae Small Boat Harbor tomorrow. Okay, so let's get right to our guest. Senator Brian Schatz is here. You'll have to forgive our technology, of course. We know it's not the clearest picture, but the audio works, and we're happy about that. Oh, actually, it's better than the test. So good morning, Senator. Thank you so much for being with us.
Oh, I don't know if you can hear us.
Ryan, I can hear you, but not Yunji.
Okay, so well then we'll let
lead this conversation.
Senator,
if you can sort of provide us with maybe an update of where we are at right now on the federal level. And we know that there was a historic stimulus package that was just passed. Sort of update us sort of on those efforts.
Sure. This is the biggest stimulus that the Congress has ever passed, $2 trillion. We announced last week that we thought that the minimum amount spent in Hawaii would be around $4 billion. It looks like that number is going to grow as the PPP, the Paycheck Protection Program, gets fully implemented. Our banks, our small businesses, the Small Business Administration, small business development centers, everybody's trying to participate as aggressively as possible. And we're hearing that hundreds and hundreds of millions of dollars in loans are in the process of being secured, which will save tens of thousands of jobs. That's the good news. The bad news is that it's not nearly enough, and there are lots and lots of small businesses that are sort of still in line. But stay in line, because it is a first come, first served thing. So please stay in line to make sure Hawaii gets its fair share. And then the unemployment insurance piece is really critical as well. We increased the unemployment insurance amount, and we sort of opened up eligibility to make sure that gig workers, people who had their hours reduced, freelancers, anybody negatively impacted is likely to be eligible for unemployment insurance help. And then we've just got to get money to our hospitals and our clinics and our nursing homes. There's a $100 billion fund for that. That sounds like a lot. It is not enough. So in the next bill, we're really going to be fighting to keep our hospitals alive.
One of the questions that we saw yesterday with Director Murakami from a lot of people were, when can we expect to maybe start seeing this direct payments, the stimulus money that is coming to them for those that qualify? Is there any indication of when the federal government is going to start releasing those funds and when people here on the ground can start expecting to see that?
So we are being told that it's in 1.5 to 2 weeks for everybody who has direct deposit. So if you're a Social Security recipient, or if you have direct deposit with the IRS, then you're likely to see money hit and you make $75,000 or less as an individual, then you're likely to see the money hit your account relatively shortly. Um, After that, they're going to start cutting checks, and they're going to start cutting checks on the basis of income, starting with lower income individuals. What we're trying to do with Treasury right now is to see if they can set up a portal so that the maximum number of people in the next 10 days or so can sign up for direct deposit, either if you're a Social Security recipient or a regular taxpayer, or both. If you sign up for direct deposit before the money gets transferred, then maybe you don't have to wait for a physical check to arrive in the mail, and then you got to go down to the bank and deposit. It makes no sense. So we're trying to fix that problem. But for those who get direct deposit, which is 60 million Americans, it should be relatively soon.
And one of the things I think that we heard yesterday as well, and maybe some people are maybe frustrated at, is just the communication and the lag that's coming in from the federal government side. And we know that this is a big bill that's been passed, and there's a lot of logistics. If you can speak to that about the amount of time that maybe it's taking, and for people to understand that this is a pretty monumental bill that's been passed.
Yeah, I mean, I look, I'm not here to make excuses for the Trump administration, that is for sure. But part of our job in terms of implementation is to be on the phone with the leaders of these agencies to try to make this thing work. So this morning, first thing in the morning, I was on the phone with our small business administrator nationally to talk about the needs for our local banks to basically be assigned the additional ability to push out loans. She sounded responsive. We want the USDA to provide clarification on whether farmers should be going through the Paycheck Protection Program or to the Department of Ag. We think we've got clarity on that, which is they should at this point apply for both and then figure out what works best for them. They can't eventually pull down both programs at the same time, but again, get yourself in line. And with Treasury, it's been a little bit harder, but I consider that the job of my office to sort of make sure that the administration executes and is held accountable. And then the other part of this is just to get good information out. And we have a resource online at schatz.senate.gov. If you've got any questions, we've got like a dozen different fact sheets from veterans to seniors to small businesses and contractors that pretty much explains how this bill works. So that people get the maximum benefit to which they're entitled.
Yeah, we have it for you now. Let's see if Yunji, we said.
Can you hear me now, Senator?
I can, yes.
Okay, wonderful. Sorry about that. We work with the technology we have. There are a lot of folks here in Hawaii, housing costs are so high and they're very concerned about their rent or their mortgage. Is there specific help for those folks when it comes to rent or mortgage assistance, and what does that look like?
Yeah, so it's a really important question. There was very little in the CARES Act that actually provides cash assistance for rent and mortgage. So that's someplace that we failed in those negotiations. It was a bipartisan negotiation. We tried as much as we could, but didn't succeed. Where we did succeed is that there are a lot of cases where if you're a renter or a mortgage holder, that you may be entitled to forbearance. And it's important to understand the difference between forbearance and a waiver. Forbearance just means that you don't have to pay your rent or your mortgage right now, and they can't kick you out of your home or foreclose on your home. That does not mean you don't owe the money. It's just a pause on having to pay, but you're still eventually going to have to pay. But for a lot of people, that's great. That'll get them through the next couple of months. And there will be essentially prohibitions on evictions for renters. The challenge here is that it applies to some people and doesn't apply to others. And so that's why you've got to really go and talk to your landlord, or HUD has housing counselors. Call them. Also go to schatz.senate.gov. But one thing I'd add is that, a lot of people are like, well, I'm not in public housing. I don't get subsidies for my rent or mortgage. That's not the way this bill was designed, to only impact the kind of lowest of low income. This was designed to have the broadest possible impact. So we think up to 60 to 70% of renters and mortgage holders could be eligible for forbearance and some level of protections. So you got to figure out that on your own, because I can't do the case management over the internet. But go to schatz.senate.gov, call your mortgage servicer, they will know or should know, or call HUD and call the housing counselors. But you may be entitled to what they call forbearance.
And in that forbearance, how long is that window typically? Are we talking 1 month, 3 months, 6 months? How long does that usually
Uh,
last?
it depends on the individual situation, but I think the minimum is 3 months. But I'm doing that off the top of my head, so I would want to confirm that in writing.
Okay, yeah, a lot of great information coming down. You mentioned that there is a real possibility that you guys will have to go back and do another stimulus package. What does that look like, that process, now that we know that there are so many, basically everyone's at home, right? Congress members are back home. What does that look like? How does building this new additional support look like working remotely? Will Congress get back together, I guess, in DC?
Well, it's interesting. I mean, two things. First of all, let's talk about the next bill. The next bill will have new stuff in it, but the basic framework of the original CARES Act, unemployment insurance, support for hospitals, support for our small businesses, and some sort of fiscal relief for not just hospitals but states and counties, is in my view, the basic structure of this, and food assistance. But the idea is the national government is telling everybody to stay at home, so it is an intentional shutdown of at least 30, 40, 50% of the economy. And in exchange for that, we have to allow people to survive economically. So that's the framework for not just the last bill, but a bill going forward. And we're going to negotiate and argue about other aspects of it. But that's how I see the next, we're calling it COVID 4.0 or CARES 2.0 would go forward. Logistically, how we're doing it is the way we've been doing it for, I guess, about a month and a half, which is we don't meet anymore. And I was sort of screaming and yelling with members on the Democratic and Republican side. We still had as of early March, we were still having these buffet caucus lunches where we'd get, 47 senators plus 2 or 3 dozen staff in a pretty small room and eat a buffet lunch together. And we finally sort of canceled those. I stopped going a little earlier than everybody else did. And now we just have regular conference calls, which, by the way, are a little more constructive anyway, because we get right to the work. So we're going to be negotiating the bills. All of my staff is completely operational in terms of telework. The only part that becomes a logistical difficulty is the physical showing up and voting yes or no. That becomes less of a challenge if we get good bipartisan support, which we did on the last CARES Act, so that it ended up being 96-0. If we have good bipartisan support for the next bill, then the voting part is, I don't want to call it an afterthought because it is a requirement by the Constitution, but it is actually not the hard part. The hard part is the negotiation that goes into it.
So many people just feel overwhelmed by all of the things that they have to think about. There's the physical risk, there's the economic risk. What is your advice just to people in Hawaii that are facing all of this? How should we sort of sustain ourselves? Because this could be for a very long time.
Yeah, I mean, I don't have any special wisdom just because I'm in the Senate, but my personal advice is allow yourself to feel stressed. Like, it is okay. This is hard. Even those of us who are lucky, and I count myself as lucky, you guys are very likely lucky too. It's still just a logistical nightmare to try to make your bedroom operational, or to try to figure out how to pay the rent or pay the mortgage or get food for grandma or whatever it may be. This stuff's hard. So, secure the home front first. Second, there is federal assistance. And even if you're not the kind of person who normally thinks that you need support from the federal government, don't be shy. The purpose of this bill is to allow people to continue to sustain themselves during this incredibly difficult period. But I think you're right, Yunji. We just don't know when this is going to end. And so, although I think it was really important for all of us across society to commit to, whether it's 15 days or 30 days, to flatten the curve and to make sure our healthcare system can absorb this coming spike, we do need to understand that at the end of this 30 days, we're not just snapping back into normal life, that life is going to change for many months to come and possibly more than a year until we achieve, therapeutics or vaccine that will really solve this problem in a definitive way. In the meantime, we've just got to be good to each other and survive the moment.
Yeah, and I want to get back to one point that you made, which I think is really important, this idea of getting in line. A lot of these forms, we talked to Scott Murakami from the Department of Labor and Industrial Relations yesterday. A lot of these forms aren't necessarily designed for folks who are 1099 gig workers. They're not necessarily designed for the economy we have. It's designed for the economy that was. So when you tell folks to get in line, it's basically, do we just fill out the form to the best of our ability and then figure it out later? I mean, because sometimes you look at those forms and it's like, well, this doesn't really make sense for me in the situation I'm in. We heard a lot from Uber drivers and different people in the comments yesterday.
Yeah, generally speaking, I think you do whatever you can to mark down that you've submitted an application, and then you're very unlikely to have lost your place in line. I can't speak for the Department of Labor, but I always, err on the side of uploading an application and saying, I'm eligible for unemployment. But specifically on how the DLIR is supposed to administer this new world, I know they're working as fast as they can. I know they quadrupled server capacity. I know state government is trying to provide more, call center capacity, but everyone is trying to board this moving train. Our UI system is actually doing a lot better than other UI systems. A lot of other systems have, as a matter of law, that you physically have to show up at the unemployment office, which is also by law shut down. So Florida and other places are just an absolute nightmare for people. We're still, really having great difficulty, but I think Director Murakami and everybody else understands the magnitude of the challenge. So stay in line. I know we're waiting for federal guidance from the Labor Department on how to deal with, as you say, people in the gig economy or who are freelancers. But stay in line, advocate for yourself. You deserve it.
All right. Yeah. And a lot of great information provided again on your website that you sort of spoke about. And you guys kind of actually break it down for different people in different categories. So I think it's a great resource. We'll also put that in our description for anyone that may have come in late and want to go back and review that. We want to for sure allow that opportunity to happen. Senator, we know that you're a busy man, and we thank you so much for taking the time to join us here today. And we really appreciate you sharing those thoughts on what's happening on the federal level.
Thanks, you guys. And thank you both for what you're doing. This is a real public service. I appreciate it.
Thank you. Well, despite those technical difficulties, it's really good to hear from the senator, giving us a little bit more of a time frame. And it sounds like that CARE 2.0 or CARE 4 is in the works. And again, we do remind you, schatz.senate.gov/coronavirus is the full URL. Go over there, and it's a little bit cut off, but that's because of the limit of the technology that so I did put it in the show descriptions, schatz.senate.gov/coronavirus. He really breaks it down, like he said, for different workers, whether you're a veteran, whether you're 1099, whoever you are, they really take you step by step. So that's an excellent resource for you. And we do appreciate, we know that he's very, very busy, and we appreciate all of your questions. We also want to get to a few other of the big headlines of the day and talk about who we're having next. Lieutenant Governor Josh Green is calling for more extensive testing. This is an interesting debate that's going on in the medical community, and it's pitting a lot of medical professionals kind of against what the health department is doing. Now, the health department argues that only people who have symptoms should be tested, though there is new evidence that asymptomatic people can be carriers. So they're arguing that, to test everybody would be a strain on resources, and the way we treat asymptomatic patients doesn't really change because we're all supposed to be social distancing anyway. Dr. Green and others in the medical community say that anyone who had intimate contact, so like if you live with someone or you work with someone with a positive person, should get testing. Right now, state labs are running 1,000 tests a day. They could be running 1,500. That's the max capacity. So we'd love to hear from you what you think. And the Lieutenant Governor will be here next week. So we're going to ask him questions directly. Make sure you tune in. I believe it's Thursday.
Yeah, next week, Thursday, we'll be speaking to him. And, one of the things that I think puts this into perspective as well, in going back to our conversation we had with Dr. Rupi on Monday, is that this is new for everyone. I mean, so there's no precedence in terms of the protocol that they follow with masks or no masks, with testing or who gets tested. All of this is sort of being developed on the fly within these 3 months that this has been going on, while looking at what other countries and states are doing. They're really just trying to figure things out as it goes along. So there may be some conflicting of agreements and disagreements and opinions in terms of what and who should be tested, amongst other things. So I think that it's important to keep that in context, as a lot of this continues to evolve as we move forward in this discussion.
Yeah, absolutely right. The other thing that the Star-Advertiser has today, we love to bring you resources. The paper's done a great thing. They have a tutorial. It's a video tutorial, so super easy to follow along. How to make yourself a fabric face mask if you don't sew or don't have a sewing machine. So I know a lot of you folks, yeah, Ryan and I were just talking about this yesterday. He needs a mask. So super easy. You just need a bandana or a scarf, a paper coffee filter if you have one, though you can make one without it, and 2 hair ties or rubber bands. So go to the paper's website, watch that video tutorial. It takes about 2 minutes, and there you have it. You can make yourself a mask.
And again, going back to, and it's a great plug for all of you to go back and watch our prior episodes, because we learned just as much as all of you that maybe what we hope that you guys are learning. But one of the things that Dr. Rimpey said, again, realistically, they understand and they realize that the masks that people are making, these cloth masks, aren't necessarily the masks that you're going to be using, that the frontline workers are using, that's used to protect. It's really a preventative measure to stop people from touching their face and to really limit what you're exposing as well. So it's sort of it works, but it's not something that's going to prevent you from getting it. It's more of a preventative measure that will assist in that effort. So again, encourage you to go to the Honolulu Star-Advertiser to review that article. There's also an interesting discussion about how far surfers and joggers should be. We know that one of the things that we as a community are allowed to do is exercise. So we see a number of people out there running, as well as in the water. Some people are saying that some of these surf spots have never seen as many people because it's sort of like the only outlet that these surfers have. They say to treat this distance between surfers and joggers as if it is like someone smoking a cigarette. You try not to stand downwind, and you want to be away from them so that you're not inhaling the smoke that's coming through. So I thought it was a pretty good article and a way to put things into a very easy context to understand when trying to figure out how close I can get to people maybe in the water.
Yeah, 6 feet may not be enough. So the point is stay home. And remember, this isn't forever. This is just temporary. So the more we do this, the better. Teresa Marie Tucker says testing people thinking of the cost versus lives makes no sense economically if the total economy is closed down, saying just test everyone. So that is one opinion, and that seems to be the prevailing thought from the lieutenant governor. But of course, on the other side are some health officials who say that we might be wasting resources if we take that route. So please continue to share your comments with us, and we're going to have that conversation directly with the lieutenant governor next week. We always like to talk about a Hawaii hero. In this case, it's kind of a national hero. Hilton Hotels and American Express have teamed up to donate 1 million hotel room nights for frontline medical professionals. This is awesome. This is so that those workers have a place to stay between shifts, and they don't necessarily put their own families at risk if they are asymptomatic carriers of the virus. So we send our thank you to Hilton and American Express for doing that. We know that's a big gift that they're giving to the country.
Yeah, and we're seeing, of course, we have the Hilton Hawaiian Village and Hilton Waikoloa Village on the Big Island. So big parts of this community, and great to see them finding ways to get involved. So we thank the Hilton as sort of our hero for today. And we're seeing a lot of that as well. We're seeing other hospitality partners jump on board to make those rooms available that the HTA is working directly with to sort of facilitate that relationship between doctors and the medical staff, as well as the hotels, so that the exposure is not maybe going back to these families of these doctors. So great to see the people stepping in whatever way they can.
Lisa's got a good question. Any federal relief for commercial landlords who are not receiving rent? So the senator talked about how there could be some forbearance, which means that if you have a mortgage on that property, you might be able to delay payment. That doesn't mean you're off the hook for payment, but you might be able to pause for a few months. But in terms of getting direct payment for rent that is missed, that is something that I don't think I have seen a lot written about. Perhaps that will be in the next stimulus, but that, that is sort of the next step. Right now, it's just keep people in their houses. But in terms of landlords actually receiving rent, right now the relief seems to be more on the mortgage or the rent side, as opposed to actually making those landlords whole.
Yeah, and he also said, for one of the things that he's recommending is just for people to talk directly with their landlords, with their lenders, and describe the situation that you're in. And, there is definitely a grace in all of this, and that they're looking for ways to support as many people as they can. They recognize that this is something that is impacting businesses as well as individual homes. And so I thought an interesting point is too, a lot of people maybe have that mentality that I don't normally seek help from the federal government, and I don't necessarily am someone that wants it, but I think that's what we're here for. That's what, the Congress and the federal government is supposed to do. So
right, those are your tax dollars at work, and this might be a time when you actually need them. JJ Laea has a good question here. We should be social distancing, but construction workers don't. So a lot of the thinking around letting the construction workers continue and be considered essential is that is part of the economy that we can continue to keep going when so much else has been shut down. But tomorrow, Mayor Kirk Caldwell is our guest, and we can ask him those social distancing exemption questions directly. There's the state mandate and, of course, the county mandates, and those are now in line. But we can ask him about those shovel-ready projects and, whether those construction workers should be out or not. I know there's a big push to keep some part of the economy growing, which is why they're out there. But put in your questions for the mayor. We know that you guys will have a lot of them. You might have some social distancing questions. No doubt there will be a lot to talk about with Mayor Kirk Caldwell. So we're excited to have him on tomorrow right here at 10:30.
Yeah, and I know in regards to that, I think one of the things that the city wants to do is really push along those public works projects, because if there's ever a time to do this and get some of these projects done that become a hindrance on the community, it's right now where people are at home. So I think there's been a big push to sort of repave the roads and fix those potholes and do the things where it's not necessarily a bearance on all those people who are stuck in traffic because of this construction that's happening. So I know that was one of the initiatives as well, is practicing social distancing while using this as an opportunity to get some of those projects out of the way now, while the roads and other projects and areas are available. So yes, type in your questions for the mayor. We also have a big week next weekend as well. Great lineup. Governor Ige will be here next week, Monday. We are also going to be speaking to Senator Hirono, as well as Lieutenant Governor Josh Green. And we also have our Superintendent Kishimoto that's also going to be joining us next week as well.
Yeah, we know a lot of parents are watching this and want to know, when is school going to come back? What about summer school? What about the fall? So the superintendent will be here. We can't wait to talk to her. I'm seeing a lot of rail questions. We're not going to answer those today, but save those for the mayor, because that, of course, is a city project. And we'll see what he says about rail construction and how that's going. So we're looking forward to having him on again tomorrow. So what are the things that you can do? What are the things we can all do? Well, we can stay home. We can also fill out a survey, HawaiiFightsCovid.org. In lieu of getting everybody tested, this is one way that we can actually track the virus. This is a very simple measure that it's contact tracing. So it's a way to sort of see where the virus is going, see who's in contact with who. It takes 2 or 3 minutes to fill out this survey. Super easy. HawaiiFightsCovid.org. It's being pioneered by some researchers at UH and other universities. So please go fill that survey out. We can all do it. If you can be online and watch us, you could definitely do that.
And we also want to encourage people, there is a lot of need in the community, and we're seeing it from meals being served, as well as just the masks and the efforts that are being made. But there are other things that are happening right now in the community where people need support. And so we want to encourage everyone to head on over to coronavirushawaii.com. If you are looking for a way to get involved, there's a tab on there that specifically says how I can get involved and how I can help. You can sign up, and you'll be directed exactly and directly to the organizations and the causes that you would like to get involved in. So encourage people, you may be looking for a way to help in this battle, encourage you to check that out as well.
And we appreciate all the notes of kindness. Thanks to Genevieve and Jackie. We appreciate you guys tuning in every day. We will see you right back here tomorrow at 10:30. Mayor Kirk Caldwell will be here. Give us your questions for him. We again thank the senator. We know he's super busy and we appreciate him fighting for Hawaii and Washington. Until next time, we wish you a very fond Wednesday. Have a great day. Aloha.
We'll see you back here tomorrow.